Hi guys, it's Dr. Gillard. This is a presentation over cervical spine radiographic findings, which there'll be a few questions on your final spinal palpation lab test. So study this stuff well, and here we go. Okay, this is obviously your cervical spine. Right here, notice that we have a C-shaped curve, so it has a lordotic curve. Remember, the thoracic spine was kyphotic, lumbar spine was also lordotic. The sacrum also has a kyphotic curve. There are 7 bones in the cervical spine. You have the atlas or C1, axis or C2, C3, C4, C5, C6, and C7. Remember, there's also 8 cervical nerve roots, which is a little strange. It's the only place in the spine that is true. Don't think we need to worry about that. And we studied this a little bit. There's the mandible right there. Remember the parts of the mandible. There was the ramus of the mandible, is this downward projection of bone, and it meets the body of the mandible at the angle of the mandible would be the spot where they meet. Condylar process of the mandible would be here. That forms the TMJ joint, the mandibular fossa, connects into the temporal, squamous part of the temporal bone, and then the coronoid process. Yes, another coronoid process of the mandible would be up here. Okay, here's some real bones here. So this is a lateral view of the cervical spine. It's called the sagittal view as well. Again, we can see the atlas up here. We'll go through a few of the parts. There's the transverse process of atlas. There's the posterior arch of atlas. This big knob is the posterior tubercle of atlas. There's an anterior arch as well with an anterior process, which isn't very prominent looking here. Remember, the dens would go up inside of here to connect to the anterior arch of atlas. We can't see it on this view, but we will see it. You can also see the spinous process of C2, which is also called axis. You can see it has a inferior articular facet here, where it articulates with C3's superior articular facet and process. Remember, the superior articular process is here, and it contains that hyaline cartilage, that articular cartilage, which makes up the superior articular facet. All right, you can also see, what else can you see? Transverse foramen would be right here. You have uncinate processes are here. We'll look at those better from the A to P view. Okay, I think we're going to blow this up. Let's see. Nope, we're going right to it here. C1, C2. Talked about that. That's the spinous process. Talked about that. That's the inferior articular process of C3. Okay, so if these are marked, this is a hint. This is probably what you're going to be seeing. Superior articular process of C4 would be the whole. Remember, the whole ball of wax here is the articular pillar. So these articular pillars are important. That's what transmits axial load. There's another one, articular pillar. This is the transverse foramen. Foramen transversarum is another word for it. It goes through the transverse process, which you can kind of see here. You can see another transverse process here. See another transverse process here. So we got some parts of the transverse process. It's quite complicated actually in the cervical spine. So you have an anterior and a posterior root that make up most of the transverse process. And then there's a neural groove or neural canal, or you could, that kind of makes up the floor. So the two roots, the anterior and posterior root, jut out, and then there's a floor that has actually a groove within it, and that's called the neural groove. At the end of the root, so this would be an anterior root, this would be a posterior root. Here's another posterior root here, another posterior root here. But at the ends, you have these tubercles, which are simply called the posterior tubercle of the transverse process, anterior tubercle of the transverse process. Between the two tubercles, you have a space here, the intertubercular lamella, because it's in between the tubercles of the transverse process. But that's only between the tubercles. It's not the whole ball of wax here. Okay, spinous process again is here. There's a very important spinal laminar line which you can kind of see right here. We'll look at that more on the x-ray, but that's important. It's a line of stability, and disruptions in that can be trouble. So this is the lamina right here, number 3. What else we got here? Articular pillar here of C7, body of C7 would be here. And I think that's about it. Close-up view. Didn't I give you the answers? I thought I gave you the answers there. Well, I just did. Here's a close-up view. Again, you can see how this is formed. I think I have numbers on this one. Yeah, again, so I mean, it's kind of hard to see, but there's the transverse foramen right in the center, and this base right here, that's the neural groove, and the end part of it again is between the anterior posterior tubercles. So that was called the what again? Intertubercular lamella of the transverse process is just here on the end. It's not back down here. This is actually number 8 would be the groove, the neural groove of the transverse process. What goes in that? It's a good test question. I'll probably ask you that in class. Well, that's the groove for the spinal nerve would be short-lived. Remember, just as the root comes out here, turns into a spinal nerve, and the spinal nerve immediately splits into a posterior ramus and an anterior ramus. So the anterior ramus, aka ventral ramus, is the one that goes through this groove. Call it anterior division as aka, but I think most of us like, or at least I like, the anterior or the ventral ramus. Okay, now we didn't talk about this. Okay, we can see these better from the front, but this is an uncinate process. This is a double jointed kind of a creature here. So this is the body right here. This would be the front over here. I don't know if you can see this moving or not. Front over here. And then we have a true, well, there's a little argument about whether or not this is a true diarthrodial joint. There is studies that show a synovial capsule and fluid around this. But anyway, this is the uncinate process, and the whole ball of wax. Uncinate process fits into a little facet here on the lateral inferior posterior corner of the vertebral body to create something called the uncovertebral joint. Uncovertebral joint, or the joints of von Luschka or von Leschka. Okay, so those are important. Why are they important? Who cares about those? Here's another one here. Here's a broader uncinate process. Who cares? Well, what's this thing, number 10? That's the intervertebral foramen, or the neural foramen, plural neural foramina. Well, look how close it is to the neural foramina and to the so what remember the nerve comes out of there, right? The spinal nerve, and for the most part the ventral ramus comes out of here. So these things like to grow big points or bone spurs that come out, and so you can literally get a sharp piece of bone, and it can start to irritate and rub on this nerve root, and then the patient will start to feel pins and needles at first in his hand. As it gets worse, he'll start to lose muscle function, and that's something called a radiculopathy if it really starts to affect motor function and other neurological signs. So he gets a cervical radiculopathy associated with compression of the exiting root here. So these are very clinically important. Now back here, here's the good old-fashioned facet joint, which carries most of the weight. And let's see, what do these things do anyway? These oncovertebral joints, they help and they allow flexion and extension of the spine as their main function. Okay, so this would be the superior articular process of this bone, inferior articular process of the other. Facet joint or zygapophyseal joint or Z joint would be right here. Okay, and I think we got that one. So we got the answers on this one. I'll just let you can pause it and go through there. We went through all of those. So we have some other structures. You're just going to see radiographs. You won't see any of this, but just for completeness, talked about how the spinal nerve is very short-lived. It's a mixed nerve, remember, but it quickly splits into the ventral ramus, aka anterior primary division, and the posterior ramus. This supplies the paravertebral musculature over the spine. So when you're massaging and working on muscles over the spine, this is the one. You can also do blocks of this nerve. And what else do we need to know? Notice how the vertebral artery goes through those transverse foramen. Sometimes it's very rare, but sometimes you can get a spur off the uncinate process. See, here's the uncinate process, and this one you can get a spur and it could go right into the vertebral artery. And it's rare, but there is literature on that. It does happen. Then it's interesting that we have this little fibrous band of connective tissue. It's unnamed, but it actually holds this posterior ramus in place. And there's your tubercles, your anterior tubercle, transverse process, posterior tubercle here. We can't see the trough. Oh, here we can see we can see the end of the trough between the tubercles. Again, was the intertubercular lamellae here. And the whole trough, again, just calling the, what are we calling that? The neural groove of the transverse process is the whole ball of wax. You can see a nice inferior articular process. Okay, I don't need to go over this anymore. So here's now what's a parasagittal cut? A straight sagittal cut is right through the center of the spine. It's like if a samurai warrior jumps out in front of you with his sharp blade and is staring you right in the face, and then he cuts you through the crown of your head, through the tip of your nose, down the sternum, through your belly button, and your trunk, just like a cartoon, falls to the left and right. That's a perfect sagittal cut. Now if the samurai warrior cuts you through your eyeball, and maybe between your sternum and your nipple, see, it's a little off center, right? That's a parasagittal cut. So that's what we have here. This is a parasagittal cut to show the facet joints. And this is what you're going to be adjusting all the time in the cervical spine. So take a look at them. Notice what's the plane of them. So we have an S to I slope here. So keep that in mind when you're trying to adjust and you're only going P to A. So you're kind of jamming the joint. That's why you have to have a little I to S line of drive to help slide these facets over one another. But I digress. You won't be tested on that either. Okay, hey, what do we got here? Our first radiograph. Okay, a patient of mine. And what do we see? So this is a sagittal image. Now remember, X-ray is not like a CT or MRI where you can see, well, you can't see a three-dimensional picture, but you can in a way, because you can go cut through cut through cut through cut. You can go right through these cuts, like the samurai warrior would take 20 cuts of your spine, and you could look at them like kind of like shuffling cards or flipping through cards. X-ray's not like that. It's like getting run over by a steamroller, and everything is smashed into this flat image. So the left and right transverse processes are smashed together. Facets are smashed together. Both sides of the body of the mandible are smashed together. If you look real close, let's start with the mandible here. So here's the body right here, here's the teeth, and you can see, look real close, you can see there's one side of the mandible. That's the right one, that's close. It's a little smaller, so it's closer to the film. So there's the right one, and I don't expect you to know right from left here, but there's the left one. It looks a little bit fatter, so it's a little magnified because it's farther away from the film or the cassette. See that? But they're superimposed. All right, let's get to some stuff here. I want you to, I know it's not on your list, but it's such an important structure. This little holder right here, this little cave, is the sella turcica. Sella turcica. Next in gross 2, we'll learn a little bit more. The dorsum sellae is here, or there's different tuberculum sellae is here. There's different parts of it, but for now let's just call it the sella turcica, and the pituitary sits in there. Then what's this bump right here, you think? That's the external occipital protuberance. Remember, that's one of our landmarks for this unit, so that's fair game. This is all occiput right here. Now, what are these little soap bubbles here? These are the mastoid air cells. Mastoid air cells, and you can actually see soap bubbles if you look real close. See them coming down and around? Guess what that is? That's chiropractic contact point. That's your mastoid process. A little tough to see, but it's all right in here. Okay, we did the body of the mandible is here. Here's the angle of the mandible. See it curving? We'll see you can actually see this on a to P view. We'll see later. And then this is the ramus. It's a little harder to follow up, but right up in here. So that's the coronoid process. Condylar process right here. There's the head of the condylar process, which makes up the TMJ joint right there. What are these things right here? This patient had a fractured jaw bilaterally, right? Two sets of screws on each one. Actually, he had it was dental work done. They wanted to shorten the jaw to improve his bite, so they fractured it. Okay, let's keep working. So here's atlas right here. Okay, so this is the spinous process. This would be the lamina. What's this line right here? See it? Here's another one. Another one. We got a little rotation, so that one's not as pretty. That's called the spinolaminar line. Spinolaminar line, and it represents the junction where the lamina and the spinous come together. That's how this proves that the spinous process is actually part of the posterior arch, because you can see how far it goes. So this is all posterior. This is not lamina. This is the posterior tube or arch of atlas. This is something, see this faint tissue here? Vertebral artery runs right in here. This is actually called a posterior ponticus, but that's kind of beyond the scope of this. But it's anomalous. You don't often, well, you do. This is more common than you think. Anterior tubercle right here, that is superimposed on the anterior arch of atlas is here. Now you can see the dens coming up. There's the a space called the ADI space. That's beyond the scope of this, but it's very important that you measure this. In car accidents, it's unstable if this is too big, or in certain arthritic processes it can get too big. This is the dens. See it all here? This is the body right here of axis, or C2. Okay, and there's its posterior arch would be here. Lamina. Inferior articular process. Body of C3 would be right here. Now I don't think I marked this, but can you see this little loop right here? See, there's the increase in bone density. That's the transverse processes superimposed on one another. Transverse processes. Okay, now we go back to these things right here. Okay, so we have this one is the superior articular process of number 2, 3, 4. Superior articular process of 4. Inferior articular process of 3. Third vertebra. Articular pillar is the whole ball of wax. You can see why they're called the articular pillars, right? They literally look like a pillar of bone here. Spinous process is back here. The space here, what goes in here? That's not the intervertebral disc. Some of you got some points off for that, right? I don't see any disc. I see a space, so that's the space for the intervertebral disc. And specifically, that's 2, this is 3, this is 4. The disc always gets the name of the bone above. A lot of structures get the name of above. So this is the L3 disc, or it's safe to call it the L3/4 disc, which is in common practice, but in strict anatomy terms, it's the L3 disc. What's this thing out here? That little movable bone, that's the hyoid bone. Okay, now we got some air shadows you'll learn next in Gross 2. We'll talk about these pharyngeal regions. This is the oral pharynx right down to here. Comes down to the epiglottis here. There's the trachea, right? Esophagus would be back in here. We'll learn all these. Maxillary air sinuses, you don't need to know that one right now though. Okay, just to help you if you're having trouble, you can go back and forth to help your eyes hallucinate this stuff in here. Okay, I think we went over all these already. And you can pause it and take the quiz and see how you do. Let me make sure I got them all. I'm sure I did, and then some. Don't forget these are important. I should have marked these. See the transverse process here? It's like a little U. Here's another one. Here's another one. Transverse processes. There's your answers. Leave it up there for a few seconds. Okay, that should be good. Let's go to the next one. Now, these are important. These are lines of stability. So especially car accident patients, anybody who's been punched in the face, any type of trauma has to be assessed. And the way you do it is you look at these. There's 3 lines. Pink line would represent the anterior longitudinal ligament. Hopefully you're learning that in class and you can see those. This is the posterior longitudinal ligament. And this is that spinal laminar line, which is important. So those need to be in place, because what if your patient comes in, here's your 4 o'clock patient. Okay, so what do you see here? I'll give you a second. There's 2 weird things on this. All right, notice this is even in a flexion view, so this is trying to magnify any slip. Well, let's check out those lines. Let's do the anterior longitudinal line. So that would be running up smoothly. Oops, what happened here? That doesn't look very smooth, does it? No, this is way too far forward. This is called the anterolisthesis. You could call it a spondylolisthesis as well. Grade 1, and that's not good in the neck, right? Because the spinal cord sits right back here. This can kill you if it's up this high. This is, let's see, oh, is there something else weird here? But let's check the other one. So here's the spinal laminar line. Okay, so it looks nice, smooth here. And then, whoa, where'd it go? I can finish the line here. See, I could draw it like this. I could finish that. But where is it here? It's way up here. So that's another way if you didn't catch it. Posterior longitudinal ligament's a little bit harder to catch, but hopefully that jumps right out at you. This patient needs to be referred out of your office immediately to the emergency room. Right? You can't adjust them. You could kill them. So now let's look at this. Now, why is everything so weird looking here? How come we can see? What are those again? That might be a nice one to test you on, though, right? Because we can see. Well, the angle is not good. Whoever took the film, they might have been in some kind of well, I don't see a collar, though. They just kind of messed up the film. The technologist could see the spinal laminar line fine, but this is the posterior arch right here. And that's because their head was tilted. Now look at the body of the ramus, the inferior part here. So you can clearly see these should be superimposed, so this is not a good image. Had some surgery here as well. Those are surgical staples. So there's the dens. See the dens? There's the anterior tubercle here. Okay, so here's the body of C2. Here's C3. Where's the disc space? What's going on here? This is a congenital block of C2 and C3. It's like and this is not from degeneration. Sometimes this happens when you get in my differential diagnosis lumbar spine class. We'll see some examples of how severe degeneration the bones can actually fuse together. But this is something the patient was born with. These two bones have just grown together. It still has a neuroforamina you can see here. So that's a congenital block of C2 and C3. Okay, there's the spinal laminar line there I drew for you. All right, that's enough with that here. Let's start the anterior view here. And this is an anterior view. So this is atlas again. Now these aren't, where's the body of atlas? It has no body. So it just, actually the dens is considered part of the body of atlas, although we don't call it that. And then it has these things here. These are called the lateral masses. The lateral masses. So those are important to know. Now we have a articulation here. It's called the lateral atlantoaxial articulation, or joint would be right here, and it's formed between superior articular process of C2 and the inferior articular process of C1 forms that joint. Let's look at C2 here. This is all the body underneath the dens. The body goes down like this. Okay, now we can see these really nice here. What are these? Okay, these are the uncinate processes, and together they're making up the joints of von Luschka, or the oncovertebral joints. Remember, they allow flexion and extension, or they help with that motion. We can see the disc space here. What are all these little holes? I think they're called nutrient foramen. Those are for little veins and arteries that go in and feed the bone. Remember, the bone is living, it needs blood, and just like everything else. So that's how the bones get their nutrients. Okay, we'll talk more about these special ones though. So let's see, what else do we need? So these are the articular pillars over here now. Okay, let's see if we get a good one to look at. So this would be superior articular process here. Notice it's a little weird up here, right? These are special. C1 and C2 are not normal. C3 through C6 are the normal vertebrae of the cervical spine. So this would be the inferior articular process of C3, body of C3. They have these little lips as well. It kind of comes out of the plane of the page. What else can we show you here? Oh, we can show you the neuroforamen here. It's a neuroforamen between, so that's the C3-4/4 neuroforamina, or you could call it the C3 neuroforamina, or I guess you can call them intervertebral foramen or IVFs as well, or AKAs. And let's see. Now we can kind of see that trough, right? This is where the spinal nerve would come out. Anterior division would come right through here, or the anterior ramus, right between here. So here's the tubercles. There's an anterior tubercle, posterior tubercle, the transverse process, and the what's the space called here? That's the intertubercular lamella. And the whole notch, the whole ball of wax is just calling the groove for the neural groove for of the transverse process, and that's for here to be the spinal nerve, and the spinal nerve would turn into what's the spinal nerve turn into quickly here that finishes off in this groove? Ventral ramus. Here's a much wider one here. You can see this. I think we have a quiz on this one here. Okay, there's your anterior tubercle, posterior tubercle. See the difference? This one is much more narrow. So this patient may be prone to more radiculitis, or not radiculitis is an old term, radiculopathy or radicular pain because of this. And you can see how this one, or let's look at this, uncinate process, right? See how it's starting to hook a little bit? Some of these patients have really big spurs going right into these, like a sheep horn going right into the IVF. Okay, I think we went through all this already. You can test your knowledge. I'll leave that up on the screen there for a second. Alright, let's move on. Hey, we got a radiograph here. So let's go through this. So let's start right out here. You can see the soap bubbles give this away. There's your mastoid process. There's another one over here. Now what's these big bumps? Put your hand under the inferior ramus of your jawbone and go back toward the angle. You'll feel a dip and a bump. So guess what that is? That's the angle of the mandible. Angle of the mandible. You can really feel that. Okay, so we're missing, in this view we can't see atlas or axis very well at all. We have to do a special view called an A to P open mouth to see up top, and we'll look at that. But what can we see? We can see a disc space here. How do I know which number this is? Well, Dr. Gillard will mark it for us. No, that's not how you know. You have to go down and count. So we can see one structure. Let's start down here. So these big airplane wings give this away. These are transverse processes of somebody. Here's the other one. Okay, here's the, just like the other regions of the spine, there's the spinous process. So remember, there's got to be that kind of that funny face, the two eyes and the nose. So here's the eyes, here's the pedicle. There's another pedicle right here. Okay, now you can see the eyes and the nose, pedicles. So who is this? Well, we can look at this weird first rib. Remember how weird that first rib is? How it kind of, I guess we'll get that more next quarter in gross 2. But that's the first rib articulating with the transverse processes. So this has got to be T1. Okay, this is T1. So this is C7, C6 right here, C5, C4. On C4 you can see that, what are those little kind of devil horns there? Those are the uncinate processes. The oncovertebral joints are right here and here. So you can see them here again. Okay, so here the articular pillar would be here on 10. Okay, so you can see all the articular pillars. Spinous processes are harder to see, but there's one. Spinous process. Another one here. Another one here. So this one's a little easier. They kind of jut right out, right? Vertebral prominens. Okay, that's the spinous process of which one? Well, this is T1, this is C7. Spinous process of C7, spinous process of T1, really easy to see there. So pedicles, number 3, uncinate process is number 6, and you can count up, that would be of 7, 6. So of C6, you can even say on the right. Remember, on the test, make sure you say left and right. Some of you got points off last time on that. Okay, let's zip down. Let's go to the next slide. Okay, there's your answers. I think we covered all that pretty well. Let's go to let's have some fun here. Let me let you look at that for a minute. You're going to see that some of you in this class, one of you is going to have, maybe not this pronounced, but one of you is going to have this condition. And it can lead to a condition called thoracic outlet syndrome, which I'll talk a lot about to you. Dr. Feinberg will talk to you a lot about when we get in CC4, and I'll reinforce that in lab. I think boards like this condition, although it's kind of debatable, this thoracic outlet syndrome, about how real it really is. Okay, so let's look at this side first. Find me T1. Okay, so here's the eyes, so there's the pedicles. Here's the nice sloped rib. Rib 1 leads right in. Here's the transverse process of T1. So this is T1 right here. Okay, kind of small. This guy's got kind of small vertebrae here. Okay, so now let's go up to T7. or C7. So here's the rule. Here's the transverse process of T1. See, it ends right here. Just ignore the rib. So the transverse processes of C7 should not go more lateral than this. This is the end of the road. So we can already see the transverse processes are hypertrophic. So this patient has hypertrophic transverse processes here. So that is a high risk for thoracic outlet syndrome, as we'll learn about how the brachial plexus and the subclavian artery go through this little triangle made by the scalenes in the first rib, and it can get compressed if these get too big, and it can get even compressed more if something else develops. So what is this? What's that thing? That's actually a rudimentary rib. I guess you could call it rib 0 if this is T1, T2, this is or rib 7, but it's a rudimentary rib budding off the C7 transverse process. So this side is at high risk for thoracic outlet syndrome. Thoracic outlet syndrome, it's sometimes it's hard to tell apart from a radiculopathy or radicular pain, or pain down the arm, in other words. So we'll talk about that. Now let's go over on this side. What's going on here? Here's the transverse process border. And whoa, this one's going way too far. So hypertrophic transverse processes of C7. And look at this. You don't see this too often. This is a really nicely formed cervical rib. Even better than that one's just a little bud. This one's actually grown. So again, high risk for thoracic outlet syndrome here. Okay. All right, now this is an axial view, overhead view, axial view. So this is a typical vertebrae. Again, we have the vertebral bodies. The pedicle is right here. And then transverse process is from here out to here. That's the transverse foramen there. There's some AKAs we'll see on that. Superior articular process gives rise to the superior articular facet, or the joint. That's half of the facet joint there. Lamina. Spinous processes are bifid, especially C2, and anomalous. So be careful when you're palpating. You might feel something, you think it's spinous to the right, so you need to adjust it back to the left. But remember, these are highly anomalous, so motion palpation might be a better, I don't know if they're still, I don't think they teach Gonstead anymore, but I know Gonstead relied on spinous right, spinous left, but maybe that's not the greatest idea, because spinous processes can bend like the wind. I just showed the 8th quarter class I think it was a lumbar spinous process, L3. It was pointed way over like this. And so, yeah, but I don't want to get into chiropractic philosophy here, so let's keep going. What else do we need to talk about? Here's the anterior tubercle again, posterior tubercle, and that space in between, intertubercle, right? In between the tubercles, intertubercular lamella, and then they don't show the whole groove, the neural groove for the spinal nerve and ventral ramus. Vertebral body, we did that. Vertebral canal here, right? That's where the spinal cord goes. No thecal sac here, though, right? Or no cauda equina. They actually have, you still have a sac, a dural sac around the spinal cord itself, but now we have a real spinal cord. Okay, from the side, I don't think we need to talk too much about this, but you can see there's a pars interarticularis, superior articular process here, inferior articular process here, and the whole thing is the whole ball of wax is the articular pillar. The pars is the spot between the superior, where the superior and the inferior meet. Right in the middle here is the pars. This is the weakest region of bone. You can get a spondylolysis or a fracture of this region, especially in the lumbar spine. So the lamina would be back here, spinous process here, vertebral body here. Okay. I got a feeling, I don't see my time, but I have a feeling this is going to be longer than I thought. Overhead view of C1. We talked about this already. We have a nice posterior arch here. These are not called lamina. Don't call those lamina. Posterior arch. And then we have a posterior tubercle here. Same on this side. We have an anterior arch. We have an anterior tubercle. Superior articular facet, which comes off the superior articular process. Atlas is weird because superior articular process actually arises from the pedicle. Pedicle is underneath this. So kind of a weird setup. So this is all transverse process, all of this, because the transverse process contains the transverse foramen here. The lateral mass is underneath the pedicles as well. Okay, I think that's all I want to say about that. Here's a view from underneath, just the inferior articular facet, which right underneath this, if we scrape through this hyaline cartilage, that would be the inferior articular process. Nothing else we need to talk about there. Axis, view from the top. Here's that big pointy thing, the dens. Same deal here, superior articular facet joints. Right underneath this, if we scrape through this, then you got the superior articular process there. Now this is not called the posterior arch anymore. Now it's called the lamina. Spinous process, the biggest spinous process, or bifid spinous, is C2. So this can really get anomalous. Mine is actually way, way, way to the left. So I remember they always used to adjust me that way when I was in school, and it's like, wow, that probably wasn't even just kind of the way I was. Anyway, digress again. You can see the body right here, kind of sneaking up. Okay. Inferior view, kind of a strange shape to the transverse foramen here, foramen transversarium. This is, again, I forgot to label this, but that's just the neural central canal or the vertebral canal. You can use any one of those. Side view, inferior articular facet here. The whole thing, the transverse process, is all of this because it has to contain the transverse foramen, and we went over that. Superior articular facet is here, right underneath it. Superior articular process, right underneath that is then the pedicle. Now we can see the odontoid process quite nicely, and I'll let Dr. Rosser can get any deeper if he wants to go deeper than that with the grooves, and there's facets and other things. Okay, remember I told you that we would be able to see C1 and C2 through a view called an A to P open mouth. So guess what this is. This is an A to P open mouth. So let's look at the parts. Let's do a hard one. Obviously these are the teeth, right? He's had some fillings back here, the back molars. So the obvious one is the dens. So we can see the dens right here. So here's the body. Now steamrollered. So here's the spinous process smashed on the body. The body's also underneath here as well. Okay, you can see the superior articular process right here. We said this is the lateral atlantoaxial joint here. Here's another one here. And transverse processes would be out here for axis or C2. Right here. Here's an IVF. Remember I said it's kind of a strange angle. That's C2. Here's a pedicle. See the extra thick bone? That tells you that's the pedicle superimposed. And let's try to look at Atlas. It's hard to see here, but look real closely. Follow my mouse pointer. That's the transverse process. This is all lateral mass right here. Pedicles in there superimposed on that. Here's the other lateral mass. There's the other transverse process. See it sticking out, all this? Transverse process. Now look, this is hard, it's superimposed. But you can see it right here. This is the posterior arch coming around. See, it goes right through the odontoid here, so make sure you don't think that's a fracture. See, there's a density change here. It's actually the posterior arch going around. The anterior arch is superimposed, smashed in there as well. Now, I won't get into all the spaces. There's some some spaces and measures you learn, but this space between here and here is important. These should be pretty much the same. If the patient was in a car accident, you wouldn't want to see a big space here. Also, the articular processes, the superior and inferior articular processes, should be lining up. They shouldn't be overhanging. You can get a Jefferson or burst fracture where this will be way over here. I don't think I put one of these in here, but you're going to get lots of complex types of fractures. I think there's 4 types of the dens. One's up here, 2's here, 3's down here. But you'll get into all that. I think I actually am going to show you one of those in a minute. So what's this right here if I put a tag on this thing? Well, it's an increased density of bone. So it's got to be something sticking out that's been squished flat by the steamroller. It's got to be the spinous process of, can't be 2, there's 2 right there, that upside down wishbone. That's C3. Alright, then I labeled all these for you. I think we got everything. I'll leave this up here for a second. And what did I miss? I got everything. Talked about the inferior articular process, superior articular process of 3. Kind of hard to see there, but the articular pillar would be in here. Alright, take a look at that. Let me give you 10 seconds to look at that. Hope you saw it. This is your 4 o'clock, or this is your 5 o'clock patient coming in. Well, if you don't see it, let's go back to the foundation. Every time you look at a cervical x-ray, check the anterior longitudinal ligament. Okay, it looks pretty good, right? Posterior longitudinal ligament looks pretty good. Okay, so far stability looks good. I don't see any anterior listhesis. Now let's check the spinal laminar line. Where was that? Here's the spinous process, and here's where the lamina comes in. See it? Kind of this curvy thing. So we would be able to draw a line up just like this. Looks real nice. Uh-oh. What's it doing back here? Uh-oh. Something's wrong. Something's really wrong. Okay, some of you have seen it already. The ADI space is okay. It looks a little funky, but it's not. It's a little wide up here, but it's not horrible. You know, this doesn't even look too bad, the posterior arch. Let's check the dens. Oh, wow. Look at that. The den should be way up here. It's been broken. This is a type 2 odontoid fracture. Very, very dangerous. If you can't see it. Type 2 odontoid fracture, you don't need to know that. It's just going to be anatomy for this, but you will pretty soon.